Hi, I'm Dr. Gerald Zupruk. I'm a neurosurgeon with Neurological Surgery PC. I've been in practice since 1985. I'm board certified in neurosurgery. When I was an undergraduate in college, I was a psychology major. Eventually, I decided to go to medical school, and I found that really the most fascinating aspects of the things I learned had to do with the brain and the nervous system. When I had a rotation as a third-year student on neurosurgery, I was hooked. It was about the most interesting thing I'd ever seen. One of the things I like best about being in practice is the opportunity to meet all sorts of interesting people. On a given day, you might meet somebody who runs a bank, and then the fellow who cleans the place up at night. I've met college professors and students and people from all walks of life. It keeps things interesting. I treat a variety of problems involving the nervous system. These problems involve the brain, the spine, the spinal cord. I've been basically involved in the community practice of neurosurgery for most of my career. We see a broad range of problems. The most common sorts of things have to do with the spine. There's disc disease and stenosis, spinal injuries. Fortunately, disc herniations are more common than brain tumors. But we see brain tumors, we see bleeds, we see head trauma, and I've had years of experience dealing with all of those problems. Most patients actually don't require surgery. They may be referred by an emergency room or perhaps a primary care physician with a question as to whether neurosurgical care is needed. And in some instances, it turns out they do need surgery, but in the majority of instances, there are other means to treat problems and surgery is not required at all. The MRI is an amazing and sensitive test. It shows lots of things. The really important part is not just to have the pictures, but to get a good history from the patient, do a careful examination, and then see if what's on the MRI images matches what the patient is experiencing. It often happens that the pictures look intimidating, but they are not really causing any problem at all. It's always a good feeling to be able to tell a patient that even though we've got some interesting pictures, there's really nothing that requires any surgery and that other means will take care of the problem. Of those patients who do need surgery, quite a few of them are able to go home the same day. Common problems such as lumbar disc herniation can be treated with a fairly minimal surgical approach, and the majority of my patients who have lumbar disc surgery actually go home the day of the surgery. On occasion, if somebody has medical issues that we need to watch for a while, of course they can stay in, but for most people it's a one-day trip in and out of the hospital. NSPC is a very dynamic and growing practice. There are people in this group who have a broad range of specialties within neurosurgery, and I think that we can cover just about any neurosurgical problem that arises. There are many things that I cover in my own practice, but if there's something that requires a different expertise, it's right at hand.